So for people who don't know, OCD is Obsessive Compulsive Disorder.
Yes.
And very often the word is used as a throwaway. कि,
Correct.
अरे ये तो OCD क्यों कर रहा है? Why are you acting like you have OCD?
Correct.
Anybody who has a neat handwriting, who wants to keep their room, neat and tidy, they might be labeled as OCD.
Correct.
But OCD is a lot more than that.
Correct.
So what makes OCD more than just cleanliness?
Okay. So I'd like to break it up by explaining the OCD cycle. Keep it very simple.
Okay.
Let's say you have a smoke alarm in your house. So if there is a real fire, it's going to go off. But an OCD mind is like having a faulty smoke alarm. So even if you're making toast, if it goes off, then imagine the number of times it's going to go off and trouble you. So an OCD mind is a faulty alarm where you'll get a random obsessive thought, which is the first part of the cycle. So let's say, what if I left the stove on? Now this can put you in a state of extreme anxiety. You can spiral, your heart could race. Different people have different symptoms of anxiety. Palpitations, cold hands, cold feet, twitching in the stomach. Some will break their nails. So you'll go into a lot of anxiety. Now this feels very real. So what you will do, you want to obviously relieve yourself of this anxiety. So you'll do something known as a compulsion. Now a compulsion is something that you do because you want whatever the thought is telling you to not happen. So you want the anxiety to go away, and that can only happen when you feel 100% जो thought बोल रहा है वो नहीं होगा.
Right.
So the person goes and checks the stove maybe 1 time, 2 times, 3 times, not satisfied, 5 times. Then finally they feel अभी alarm बंद हो गया, it's off. Problem is, the message you gave yourself is सच में threat था. So every time there is a false alarm, you are going to respond like this, and you are stuck in this cycle of an obsessive thought, anxiety, compulsion to stop it, and temporarily feeling little better, like the alarm is off. So the alarm is going to ring louder and harder every time. So why OCD is so exhausting? Why I had so many years of this whole exhaustion was that every thought is treated like an urgency. So with every thought, if you are going to be in that mode, you're never going to be at rest.
Yeah.
In fact, when you're at rest, you feel something's off. It's funny, right? Because we feel anxiety is the new normal for us.
So your baseline becomes that state of stress.
Being on that alert. Because an OCD mind also is something that keeps looking. What is next? Where is the threat? What do I need to be careful about?
Right.
It's always scanning the environment. And I think as a neurologist, you would know we will find what we are looking for.
Yeah.
Correct?
Yeah.
So when I had an obsession with termites, I would walk into every room and look at those walls. Kidhar hai termites? Kidhar hai drilling? I had obsessions of bed bugs. I would walk into a hotel room and I would first want to check the bed.
Yeah.
What will most people do? They'll enter a hotel room and jump on the bed.
Yeah.
They'll jump into the pool. They'll throw their luggage. I will open the cupboard. Are there termites? Can I put my luggage?
Right.
Can I jump on the bed?
Right.
At night, I would get sensations even after checking. That is there anything? Is there something biting me?
Right. You mentioned obsessive thoughts. So intrusive thoughts are still common, right? Like everybody gets them. I sometimes get really bad intrusive thoughts of like, oh, if there is a knife, let me throw the knife somewhere. Or a common intrusive thought people get is jumping off a window or a high, like a terrace.
Correct.
If you look down, a thought will come, oh, what if I jump?
Correct.
And the first time you get that thought, you are shocked that why am I thinking like this? But then when you read about it, you realize that, oh, everybody can get them sometimes.
Correct.
What makes that different? What makes intrusive thoughts normal, but such a problem in an OCD patient?
So I think a lot of factors. Number one definitely is that we are not able to go beyond that thought by doing nothing. So suppose if you feel, let me jump off, you'll be like, what thought was that? What am I thinking? But for an OCD person, it will feel so real that they will feel, oh my God, is this real? Do I need to do something about it? And the anxiety takes over. So the compulsions will start. They may look like wanting to make sure that they've shut the window immediately. They've gone far away from the window. They might not let anyone else also go to near the window. What if they are getting such thoughts, right? So a lot of compulsions follow. And then they are again temporarily relieved. But again for them, because the loop has been reinforced, next time they are near that window, they will get that thought again. and they will do those compulsions again. There are high chances.
Right.
I'm not saying it will happen necessarily always, but for you, you would have forgotten and moved on from that thought.
Yeah.
But we remember. Many times our thoughts and our memories get associated. मैं जब यहाँ थी, I remember many places when my OCD was bad. I had gone to this boutique, I had seen termites, and I had ran away and not shopped. When I passed that shop, my mind remembers that boutique. So these thoughts also become part of your memory because emotions help you in remembering things, and fear is such a strong emotion, and the survival instinct, in us will always make us remember things which are a threat or fearful. So I think it just sort of feeds on to that loop. You will forget it. I won't forget it.
Right. I read something called thought action fusion. So when an OCD patient thinks something bad, they act like as if they have acted that bad thing.
Correct.
One of my closest friends had gone through OCD, and she told me that once she had visited some friend's house. That friend had a baby. She got a thought that I want to punch the baby or hurt the baby.
Correct.
And then she acted as if she has done it. And she felt so bad, so guilty. She was not able to keep that thought away or just dismiss it as just a stupid thought. She acted as if she would actually do it. She stopped going to that friend's house.
Correct.
Because she was afraid of what if she hurts the baby.
Correct.
So this is probably how intrusive thoughts can lead to a change in actual behavior, action. I'm thinking of the people around them. Not everybody understands OCD. So won't other people feel hurt that why is my friend stopping coming to my house?
Correct.
How does that work? So how does people around an OCD patient react when something like this happens?
So I'd like to say one thing even before I answer that question, that you said that they'll feel that they could actually harm the kid. This is exactly what I meant, that the faulty alarm system makes you feel that the thought is so real. So they feel they have full potential to do it. They may deep down know that they don't have any intention of doing so, but they'll still feel that they have the potential. Now, answering your question, it depends on how open the person is about OCD. So if they're open, they may let them know that this is what it is and I'm so sorry, but this is the reason I walked away. This could at least save the relationship partially. But OCD definitely does a lot of harm in relationships because people don't understand why people are acting in that way, because the behavior is strange to them. It is confusing to them. And humans like predictability. They want to know what is happening and why it's happening. And what happens is, more than often, because of our own self-worth issues, we take things personally. So these people are going to take things personally. They are going to project their issue onto their behavior, and that's going to sabotage the relationship. So a lot of people with OCD share about it. I am very open about it to my clients. It has helped me to help my clients with general high anxiety also, because the same techniques work so beautifully for someone with general anxiety or social anxiety. Because if you understand this was an obsession, even if they don't have OCD, but if they understand I have social anxiety, so my obsession is, what if they judge me?
Yes.
I'm anxious, so my compulsion is, let me avoid it. So the same tenets of OCD recovery. I send my clients articles of OCD recovery, the tips to recover, how to surrender and let go, to even my clients with normal anxiety.
Over the last 2 years, I've been reading a lot about anxiety, about depression, and now about OCD. And I find that neurologically or neurobiologically, the core circuits are still the same.
Yes.
So it almost feels like there is a central starting point. There is an inability to modulate anxiety. It starts from there. And then it just spirals, and then it can go into one of these roads.
Correct.
It can go into generalized anxiety, it can go into depression, it can go into OCD.
Correct.
It can even go into ADHD.
Correct.
Which is also a form of anxiety mismanaged.
Right.
But anxiety seems to be the starting point of everything.
Correct.
Are people actually getting more anxious? Is the world making people more anxious, or are we just recognizing anxiety more now?
I tell my clients many times when they talk about childhood trauma that at least you're the first generation breaking it and not passing it. So I think we're a more aware generation. Kudos to that. The world is getting crazier, definitely. Hustle culture is glamorized, so we are not eating well, we're not sleeping well.
Yeah.
You've talked about how sleep affects.
Yeah.
I loved one video where you said that sleep is sometimes the trigger for a bad mood, and we may label it onto something else that
Yeah.
isne ye bol diya, but actually it's the sleep. I really
Yeah.
like that video.
Yeah.
So we are sleeping less, we are eating poor quality. My entire tech clients are living away from home, so less community support.
Yeah.
We are almost all the time in our phones. If I see my phone, even for 20 minutes, if I'm scrolling, I usually don't scroll, I'm feeling low immediately.
Yeah.
There are times when I end up seeing my phone more when I'm traveling back from work. Usually, otherwise, I don't get the time. And I've seen that. And if I don't see my phone before sleeping, 2 hours before sleeping, I wake up with a different level of happiness.
Yeah.
So we're definitely living in a more crazy world. Also, nature. We're living in the least amount of nature. So just imagine what kind of low life quality we are living, even in a city like Bombay.
Right.
So we are definitely getting crazier to answer that question.
Oof. In a world that is almost designed to make us anxious, I have a conspiracy theory.
Okay.
Okay. The internet runs on ads. Okay, so that is the founding principle of the internet. Everything runs on ads. Everything is designed to make us click and buy something.
Correct.
So Instagram, Facebook, YouTube, all of these channels exist so that they can sell things to us. Now, an anxious consumer is a good consumer. Because when you're anxious, you will click more and you will buy more. Whereas if you are at peace, if you are feeling very good about yourself, if you're very happy,
Okay.
then you're a bad customer.
Correct.
You will not buy more. My conspiracy theory is that the internet wants to keep us anxious so that we buy more stuff.
Correct.
I want to take the conversation back into OCD.
Sure.
There will be people listening to this podcast who has either gone through these symptoms or they know somebody who's gone through symptoms. I think the prevalence of OCD is 3 in 100 or something. So we all know around 100 people in our lives, which means that we all know 2 or 3 people who are suffering from OCD. Or maybe if you don't know, then they have not shown it to you.
Yeah.
And they've just kept it to themselves. But there are people around us who are going through it. Maybe they're not even diagnosed yet. So in such a case, if there is somebody out there who's experiencing this and they don't know what to do, what is the next step? What would you advise them? What should be the way forward if somebody thinks, do I have OCD?
Okay. So I would definitely suggest to first get a clear scientific diagnosis because of the casual way in which OCD is being labeled nowadays.
Right.
इसको OCD है, ये बहुत सफाई करता है, ये बहुत organize रखता है. But get a proper diagnosis. Firstly, first seek therapy before you even start medication. I feel medication is important. I too have taken it in my life. It has helped me to cooperate more with the therapeutic homeworks that I needed to do in terms of the exposures. So first get diagnosis. Secondly, don't right away start off medication unless it's very severe. See a therapist who specializes in OCD, who understands the nuances involved, who knows at least how to do 2 things. One is exposure and response prevention therapy. So ERP therapy,
Right.
where you will be systematically taught to face your fears slowly and steadily in a scientific manner, in a manner which is comfortable yet slightly challenging. Number 2, if the counselor is also trained in CBT and ACT, because ACT is acceptance and commitment therapy. Acceptance has been a game changer for me to recover. Accepting the intrusive thought, accepting the consequence of it has helped me to reduce the compulsion.
Right.
Along with CBT principles. So if a therapist is trained in all of this and you can begin to cooperate in therapy and overcome your fears, great. If you feel the anxiety is too much, then you can take the help of starting with minimal medication, SSRIs mostly, which help you balance the serotonin levels in your brain so that it can help so SSRIs basically, if I put it in a simple language, जो thoughts का volume कम कर देगा. ताकि आप फोकस कर पाओ अपने थेरेपी पे, राइट? But that is not the final solution. Only medicine is not the final solution. You need to do your therapy also. Many times the risk is दवाई ले ली, अच्छा लग रहा है, अब कुछ नहीं करना.
Right.
So a combination of medication and therapy as per the severity of the case.
Right. One issue that I have in modern day psychiatry practice is people either go only for therapy or only for medication.
Correct.
Depending on which center or which practitioner they end up with.
Correct.
But both of them clearly have a major role to play.
Correct.
I don't see how only medication can ever help, because ultimately at some point the medications need to stop.
Correct.
And that person still needs to learn how to cope with their
Correct.
symptoms later on.
Correct.
Can OCD ever be fully cured? Can there be a situation where a person no longer has OCD? Is that possible?
I don't think so. That is possible. I would say today I live a life of recovery. Like in addiction, people live a life of sobriety. They count every year that they are sober.
Right.
I would also say I'm sober. But can I say I don't get intrusive thoughts? No. Can I say I don't feel the urge to do compulsions? No. Of course I do. But today I am capable in recognizing a thought, ready to face it head on, not engage in the compulsions and power through. I will still give in sometimes. I won't say I'm fully enlightened and I don't do it at all. But I would say I'm recovered to a very, very large extent. And which is what makes me human, which is what even makes me a good therapist, because I'm not sitting on a pedestal knowing everything. I'm as human as you are. I'm on the other side. You can also come.
I want to go a little deeper into the actual therapeutic actions. So within therapy, if I'm an OCD patient and I've come to you for the first time,
Correct.
what can I expect? What would my next 1 month be with you?
Sure. So in the first session, I'd like to understand your entire general life history also,
Right.
including your OCD history. Because it's very important to know what your life was like, what were your triggering points, right? In my personal experience, my OCD got triggered at certain very pivotal moments in my life. Secondly, with mutual consent, we make a plan as to what OCD themes do you have and which ones do you feel comfortable tackling first. Many a times, OCD is not restricted to one theme.
Okay.
Even if you have only one type of OCD, your mind will think in an OCD manner for other things you worry about also. So it is important to consider all the triggers of a person. Then slowly, I start with one theme at a time, creating a systematic hierarchy for the client as to what are the compulsions, what are the obsessions that they want to first overcome and they are comfortable letting go. So someone will tell me, I want to still use my sanitizer every day, but I'm okay to use lesser quantity this week, but I will use it every day. Maybe for someone that is the goal.
Right.
But maybe someone will say, this week I'm okay to not take the sanitizer with me when I go out. But I will wash my hands when I come back. Is that okay? So I have to give them that little buffer, right? So slowly and steadily, then they'll come back next week and they'll tell me, this was successful, this was not successful. Then I'll check what techniques did they apply? What was the homework given to them? Where did they do well? What was the reason they did well somewhere? Did they really apply the technique correctly where they failed? I check into all those aspects also.
Right.
And then I take them to the next step. It is also possible that some other life stressor came in that week. Then I'll address that, because in OCD treatment, it's important to recognize that if there is high anxiety about something else, that's going to even further exacerbate the symptoms of OCD.
Right.
So the person is holistic. He's not compartmentalized, right?
Yeah.
So you have to take care of the whole person. So systematically we take over this. Then what happens in a few weeks, the client himself will say, oh, we didn't decide on this, but I overcome that compulsion also because I thought, why not? Then they get confidence, because when you start facing fear, you start getting confident. Yeah. I remember when I was facing my fear of termites, I went into this church where I knew there were termites. I went there. I sat leaning against the wall. I took a selfie. I put it on my therapist group. And I was scared of dogs also back then. But I didn't have OCD about dogs. But I would avoid them. And then I saw a dog and I went and petted the dog also. Because the courage,
right,
the dopamine that you get, no?
Yeah.
After facing your fear, wow, मज़ा आया ये करके, ये मैं कर सकती हूँ, तो ये भी कर सकती हूँ. So then I started overcoming all the other fears as well.
Right.
So
overcoming fear is a is almost a form of practice.
It is a constant practice, and you can never become complacent about it.
Right.
So it's very important for clients to tell if they got new thoughts, new themes. I'll tell you something interesting that happened yesterday. My mom was obsessing over some pain in her arm. She started doing all sorts of compulsions, went to different doctors, acupuncturists, Googled about it, took medication, chanted for it. Let's say these are at least 5 compulsions. Yesterday evening when I spoke to her, she told me about this. So I said, Mom, do you realize it's an obsession and you're doing these compulsions? I could say this language. I felt so good that I could talk to her in this language. And she said, yes, you're right. This is an obsession and I'm doing a compulsion for someone who's never been to therapy.
Right.
But knows my language by now because I keep, the perfectionist in me wants to treat her. So she understood it and she said, okay, now I'll let go. Because she said, because today was Sunday, I didn't have anything to do. So I was obsessing more. And I was more on Google.
Interesting.
So this is how the journey looks. They eventually get better, and then we wean off the sessions as they feel better. Okay. I always tell them to once a month still come and check in if they feel comfortable doing so, to monitor their symptoms or any other life stresses before it builds up and gets too much. Right? Like you would not stop eating healthy if you're at a good health today. You won't say, abhi to acha hai, 20 saal acha khaya, now let's eat junk. You won't do that.
Right.
So maintenance is also important. Follow-ups are also important.
Right. You mentioned types of OCD, so I want to go a little deeper into that.
Yes.
So you mentioned type O. So can you explain that a bit more?
Sure. So the pure O is what I meant. Is when the obsessive thoughts are more, the compulsions may not be present. So it is more, there could be more mental compulsions like ruminating on it, getting stuck on it. So my mom personally was such a case. So I could expand on that because it's an experience. She would not have any particular compulsions, but she would keep getting thoughts if someone told her that this person A has this health issue. She would keep having that thought again and again. She was not worried about the thought. The thought would only keep ringing like a cassette, interfering with her. So another example of this type is I had a client who had a musical obsession. Music would keep ringing in their brain. They would not be able to focus. It's not that they like the music, but the sound, the tune would get stuck and would interfere with the ability to work.
Okay. Is that the same as an earworm? Like you hear a song and then you keep humming it?
Again, the point of dysfunctionality that it brings, I think, is what really helps us distinguish between OCD and other similar looking.
Right, because earworms are common. Like we all have that.
Correct.
You hear a song and then you just keep humming it, but it doesn't interfere with your work.
Correct. And you mostly might like the song also.
You might like the
So you are like thinking on loop about it, listening on loop. But this is very different. So pure O is more of the obsessions and less of the compulsions in a simple term.
So what are the other types of OCD?
Okay, so there is harm OCD, where you may feel that you have the tendency to harm yourself or someone. So such a person may get a thought like we were talking earlier, that what if I punch this kid? Or there is relationship OCD, where they doubt if they're really in love with the person, or whether the partner is loyal to them, or whether they're a good enough partner. Now, whether you're a good enough partner is a common thought, again. But in this case, they'll do compulsions, they'll seek validation repeatedly, they'll seek to overcompensate. They will not say no and set boundaries, which again, even the regular population will do. But they'll do it to an extent where almost the partner will be suffocated and actually leave, and then they'll again reinforce their fear कि देखा सच था, जो डर था वो सच हुआ. It's self-fulfilling prophecy, basically. So harm. Then of course the most common, which people know about, जो बार बार हाथ धोते रहता है, contamination. So fear of germs. So these are the people who will find it very hard to go to doctor clinics, hospitals. I've had personal experiences. I once had a very bad eye infection. It had almost hazed out vision of one eye. I was not willing to go to another doctor because वहाँ दूसरे infection वाले patients भी तो है.
Right.
Logic नहीं लगाया, brain के खुद को भी है, जाना पड़ेगा. So contamination has been a big one and a very common one. Apart from that, I feel different people can have different sub-themes, like I had for studies. Right? If I was not studying, I was anxious. I once had that, there was 2-3 years when the rain was really bad. It was low, unlike today when it has been pouring in Mumbai. And so there was a water cut. OCD caught on to that पानी नहीं मिलने वाला है, हम सब मर जाने वाले हैं. So every day the compulsion became, I wanted to check the forecast. बारिश है या नहीं है, अच्छा अगले 15 दिन में कितनी है, इनफ होगी या नहीं होगी. Every time the water tank would overflow from the next building, I would want to go down and tell the watchman to shut it. पानी वेस्ट हो रहा है. घर में किसी को चिंता नहीं हो रही है, बट मुझे हो रही है. Even yesterday it happened, funnily. They open these plastic bottles at restaurants and don't offer regular water.
Yeah.
And my mind is like already calculating that कितने लोग रोज़ आते हैं, कितनी bottles रोज़ खुल रही हैं, कितना environment को damage हो रहा है. Before I knew it, the obsession had taken over. And there was a shift in my mood. Now I'm able to catch myself. I told myself, it's okay, it's not in your control. Come back, enjoy your dinner. And then the dinner went fine. So this is the difference after recovery.
This is so interesting because I feel most people would take the first few steps in this journey.
Yeah.
Lot of us have been in that position where अरे थोड़ा सा पानी के लिए नया बॉटल क्यों खोलने का? Why aren't they serving us in glass bottles? Why aren't they just giving us in a you know, in a glass?
Yeah.
But the way you're describing it is you're taking that thought and you're taking it to its almost illogical conclusion.
Correct.
And then getting worried about it.
Correct.
So is the difference an inability to drop it?
Yes.
वो शुरुआत तो सब में होता है.
Yes.
But most people are able to
छोड़ सकते हैं
छोड़
उसको,
दे.
let go नहीं होता.
रहने देना, छोड़.
Correct.
But यहाँ पे वो छोड़ नहीं पाते.
Correct. In fact, I'll add something here. इस वजह से OCD में दो बहुत common themes आती हैं, which is guilt and hyper responsibility. हमें लगता है कि हर चीज़ हमारी गलती है, अगर हमने अलग किया होता तो नहीं होता. Again, something which common people go through. But हम क्या करेंगे compulsions में, उसको बार बार रिव्यू करेंगे. हमने गलत किया, सही किया. हम जाके रीअश्योरेंस सीख करेंगे. हम मेंटली उसके नोट्स बनाएंगे कि हम नेक्स्ट टाइम क्या नहीं करेंगे. So we are just not able to stop. So in my research of the brain mechanisms, and you would know better and I would love for you to add, there are parts of the brain which firstly sense this false thought and then the emotion magnifies it, and the way it is relayed further magnifies that emotion, and there is no filter कि क्या ज़रूरी है और क्या नहीं है. And that is what is making this letting go so difficult, because हर चीज़ ज़रूरी है. So people with OCD are not able to let go. So many people with OCD, you will find them repeating the same question for seeking reassurance, or they'll keep reminding you of the same thing again and again, like my mom will do, or they will ruminate over something that is over and does not going to realistically affect them in the future anymore, but will still want to ruminate over it. So compulsion का एक feature is repetition. The urge to repeat, to go over it again and again.
Right.
So that makes a lot of sense in what you said, that for a regular person, हाँ ठीक है मैंने गलती की, छोड़ दे, अब नेक्स्ट टाइम नहीं करेंगे, अरे छोड़ बुरा लगा होगा, जाने दे, 5 मिनट सोचेंगे. बट हम 4 घंटे वेस्ट करेंगे उसके ऊपर, या 4 दिन भी वेस्ट कर सकते हैं. So one more type of OCD is to do with order.
Okay.
A lot of people like things in order, like their cupboards will be well ordered, their files will be, they'll not have too many tabs open, they will want their room arranged in a specific way. So that is yet another type. There are still many more types to do with sexuality also. There is to do with a lot of people actually, I don't know if it is diagnosed, but I think money also is one of the most common obsessions that people have, not having enough. So I just thought of adding.
One of the fascinating things about OCD research has been that OCD के research से हमें पता चलता है हमारा normal thinking कैसे होता है.
Correct.
So when we look at the brain network pattern, there are a few areas that are really important in OCD. So one is your thalamus. Thalamus is the relay center.
Relay center.
So all the senses that come into our brain, it goes through the thalamus, and that's how we are aware of it. But thalamus is also the relay center for emotions. So हमारे limbic system में all the amygdala threat responses also kind of go through the thalamus. So the thalamus, and there's another area in the basal ganglia called caudate. So these are the gatekeepers.
Correct.
Most of those thoughts should get cleared out there only.
Correct.
But if those gates are open, all those thoughts will come into our prefrontal cortex.
Correct.
Now, our prefrontal cortex is not used to having so many thoughts. So, either shut the door,
Correct.
or if the prefrontal cortex is working well, it can say, chod, doesn't matter.
Correct.
Unfortunately, in OCD, the prefrontal cortex is not working very well. So, it gives too much importance to all these thoughts.
Correct.
So, specifically, I think there is an area called orbitofrontal cortex. So, that gives so much value. So, even if there's a stupid negative thought like, let me punch the baby, now our prefrontal cortex gives it importance.
Correct.
And now it is shocked that, oh, why am I thinking such an evil thought?
वो alarm trigger हो गया.
Alarm trigger ho gaya. And one of the most fascinating things is, when we are moving, हमारा जो actions होता है, usually our actions are under the control of the prefrontal cortex. But our limbic system also has a, like a bypass control on our actions. So in OCD, the prefrontal cortex gets bypassed.
Correct.
So if you have an emotion, it will directly go into the motor cortex and you will act, it will feel better. And the prefrontal cortex is just watching on the side. Ki bhai kya chal raha hai yahan pe?
Correct.
So this entire loop is just going on in our brain. And when I read about therapy, I suddenly realized that therapy makes each part of this network stronger. So different aspects of therapy is aimed at making different aspects of this network stronger. So acceptance is about calming down your amygdala network.
Correct.
CBT is about strengthening your prefrontal cortex.
Correct.
So we are trying to make that person better network by network.
Right.
How does that work? How do you teach somebody to accept something that they don't like?
What you're accepting is the thought of something. So let's say कि what if I lose my job? ठीक है? Most people are going to worry when it's about their health or relationship or job. So what if I lose my job? Now I may not be okay with the idea of losing my job in reality. But when you are accepting an intrusive thought, you are accepting only at the thought level कि ठीक है हुआ तो हुआ देख लेंगे. It is more of the acceptance of the intrusive thought and the consequences that might follow at the theoretical level more than the actual level, in that sense, if that makes sense. That gives you a certain power. For example, if you are scared of a dog and I tell you चलना देख लेंगे जो भी होगा, एक हिम्मत आ जाती है. Right? It is just that little placebo that you need.
Right.
That will help you to get courage to not engage in the compulsion. For example, I am not saying कि अपनी बॉस की जाके बैंड बजाओ, बट आई एम सेइंग प्रेजेंटेशन 1 घंटे में जितना तैयार होता है करो, 4 घंटे पर बैठ के मत करो. इम्परफेक्शन को एक्सेप्ट करो. नाउ व्हाट आई एम एक्सेप्टिंग इज that even if I am going to, so we use a fuck it technique, I use it, taught by someone to me. Fuck it even if this presentation is imperfect and because of that I'm going to lose my job. Makes it sound also so ridiculous, no?
Yeah.
I'm still going to do this only in 1 hour and then let go. So you are accepting that intrusive thought.
Like you're accepting the worst case scenario.
At that point. And then that helps you to get the courage to not engage in the compulsion and take a baby step towards that. A harder step would probably be जानबूझ के गलती करो in the presentation.
Okay.
Now that could be in the level of the hierarchy of systematic desensitization that we spoke about earlier. So the highest could be miss the presentation, fumble on purpose, wear something funny and go to the presentation, call your boss by the first name if you're used to calling him sir. So things like that. What I was mentioning earlier was that radical acceptance as a concept has helped me. It just helps you not go into the spiral.
Right.
Because see, when two people are fighting, ठीक है, अगर ये बोल रहा है तुम ये हो वो हो, ये बोल रहा है तुम मैं ये क्या मैं तो सब हूँ, मैं इससे भी ज़्यादा हूँ, तो ये क्या बोलेगा? तो जब माइंड बोल रहा है कि ये होगा तो हम बोल रहे हैं अरे ये होने दे ना,
Ah.
सब होने दे, ये क्यों, सब होने दे, ये क्या बोलेगा इसके आगे. माइंड को क्या मैसेज जाता है, ये डर नहीं रहा है, मज़ा नहीं आ रहा है इसको डराने में, चलो किसी और माइंड को परेशान करते हैं. सो स्लोली यू आर लर्निंग नॉट टू गिव इट ऑल द इम्पोर्टेंस. हमने जो पहले बात की कि वो फॉल्टी अलार्म को सब चीज़ इंपॉर्टेंट लगती है. लाइक यू मैंशनड वेरी ब्यूटिफुली अबाउट द फिल्टर. द फिल्टर इज सिंग सब इंपॉर्टेंट है भाई, डील विद एवरीथिंग, टेक दिस शिट. जैसे ऑफिस में सबने बॉस ने सारी फाइल्स दे दी, सब इंपॉर्टेंट है, नॉट एबल टू प्रायोरिटाइज. सो द एक्सेप्टेंस ऑफ द वर्स्ट केस सिनेरियो ऑफ वॉट योर ऑब्सेशन इज टेलिंग यू. I repeat, the acceptance of the worst case scenario of what the obsession is telling you helps you to get the courage to disengage from the compulsion and power through that anxiety at that time. So that helps a lot. Like many times it used to happen, I'm in a social function and I suddenly got an intrusive thought. And I'm not able to enjoy it anymore. And I'm upset about not enjoying it also now. So firstly, already there's an obsession which is troubling me. And now I'm creating a secondary problem that now I'm not able to enjoy this function. So there is fear, there is guilt. I'm dealing with both.
And there could be a third level where because of this, the people with me
are not enjoying it. So one more level of guilt.
Yes.
So first is, fuck it, people are not enjoying because of me. Second is, fuck it, I'm not enjoying. I'm not going to enjoy anything in my life, ever. I'm always going to be so stressed always. See, now you are cringing at that fact.
Yes.
But that has helped me to come back to the present.
Wow. Okay.
Right?
Yeah.
ठीक है. So many times client ask me, अरे कैसे accept करूँ this, I can't accept. I said करके देख. खाली 4 बार बोल के देख. You begin to accept it. And then the final acceptance is, fuck it, जो भी चीज़ का fear है कि ये हुआ तो भी चलेगा, right now, come back. Now that's where mindfulness helps, right?
Yeah.
So थोड़ा mindfulness आ गया, थोड़ा acceptance आ गया. कंपल्शन नहीं एंगेज किया तो ERP आ गया. इट्स वेरी होलिस्टिक. आई ऑल्सो गिव देम मेडिटेशंस लाइक जिब्रिश बाय ओशो. इट्स लाइक हाउ यू गिव trash every day so that your house is clean, your kitchen is clean. So gibberish is a meditation where you speak in nonsense language.
Okay.
And in the Osho ashram, it's like a 1-week intensive course where people do it for hours. They talk nonsense for hours.
Nonsense as in nonsense words, nonsense sounds.
Yeah, nonsense sounds, nonsense words. Just a ramble. So you start off like you're gargling and whatever comes out then.
Okay.
Nothing conscious.
Okay.
And then followed by silence. So it's a very good way to not just detox intrusive thoughts that are on your surface, but also deep thoughts that are somewhere there in your subconscious but may have not yet made their way to trouble you. So it's a very good way. Prevention is better than cure.
Wow. I had this realization that we are all on a spectrum. So just like how somebody with OCD will have discomfort at breaking the boundaries, even somebody without OCD will have trouble at breaking the boundaries.
Correct.
So while you were explaining all this, I felt that every exercise that you are teaching to an OCD person,
Correct,
even somebody without OCD should do those exercises because it will absolutely help them.
Absolutely. Everybody with a general anxiety problem can benefit deeply. And like I said earlier, I give them the OCD techniques, I give them the articles, I give them these meditation techniques and all other holistic techniques. One more thing for an OCD person that can benefit them is that any thought, even if it is not a part of their OCD theme, they can treat it with the same level कि हाँ ये भी OCD है. So even if I'm worrying कि आज मेरी maid नहीं आएगी, आज बारिश में है, I'm meeting Dr. Siddharth today, how am I going to meet him? What is he going to think about me? First impression. So let him think she's so unprofessional. अब ये तो मेरे OCD में नहीं था, but इसको भी बोल दिया.
Right.
So OCD में मज़ा इस बात का है कि आप हर चीज़ को as a false alarm लेके उससे free हो सकते.
There was this line that I had read that perfectionism is a form of anxiety. That if you are constantly aiming to be perfect, nothing should be wrong, that in itself is because of anxiety. Is that true?
What is perfectionism? Okay, firstly, there is nothing called perfectionism. If I say that you should know everything even about neuroscience, is it possible?
No, of course not.
Let alone all the medical fields, you should know all the languages, at least in India. Is it possible?
No.
So perfectionism, according to me, it's my definition, is a goal that you set to feel good enough. So if I'm 60 kgs, I'll be good enough. Now, the minute there is a goal, you are anxious because what if I don't achieve that?
Right.
So the anxiety game starts the minute there is a goal.
Right.
Because, not because there is a goal, but because you attach your self-worth to that goal. So I am not good enough till I reach that goal. You can have a goal because people will say, so should we not keep goals? Keep a goal. But the approach has to be that I am putting my effort and my worth is equal to my effort. जो भगवद गीता का essence है, do your best and leave the rest.
Right.
You do your efforts, you look towards your goal, work towards it, but whether or not you get the outcome is not in your hand. There are a lot of factors that are going to affect that.
Right.
So the minute you strive for what you think is perfect in order to feel good enough, you are going to start your anxiety trip, and it's never going to end, because the minute you're 60 kgs, now it will be, now I need the perfect now I want the perfect job or the perfect partner.
Yeah.
Right? And the goalpost will keep moving every time you reach there. What are you really striving for is the feeling of wanting to feel good enough finally. That is perfectionism. I am perfect when I dash. If you ask yourself this question, so am I perfect when I catch every flight and not miss a flight? Right? It's ridiculous, right? To set yourself up for that. It's not in your hand. And so, Dr. Siddharth, in my work, self-worth along with OCD has become the cornerstone of my work. Because what surprises me is I have people who have won awards in their professions, but they still don't feel good enough when they're starting something new.
Yeah.
And in OCD also you need good self-worth. Because if they are able to say, कि ये हो गया तो हो गया, मैं मैनेज कर लूँगा, मेरे में वो जिगरा है, तो self-worth अगर है तो OCD में कितना काम आएगा? You can imagine.
Right.
So बहुत ज़रूरी है.
A lot of self-worth comes from the childhood experiences that we've had.
Correct.
So the converse of that can also be true. So if you have had bad childhood experiences, or if you've had childhood trauma, that can lead to a lot of self-worth issues when we have grown up.
Absolutely.
So does OCD also have any roots in childhood trauma? Are there things that can happen in childhood that can lead to OCD?
So it can trigger the OCD.
Right.
So in my family, we have OCD since at least 4 generations.
Oh wow. So it's a strong genetic component.
Strong genetic component.
Right.
So for me, my first OCD probably may have got triggered by seeing an anxious mom all the time. That was a chronic stressor in my life. Maybe I felt in control when I studied. Maybe that became a way to feel safe in my environment, because that was the only way I could control. A lot of high functioning adults, they want to do well in their career because a lot of things have happened in their childhood which were beyond them. So money becomes a way to stay in control of their lives. They can make their choices. They have freedom to take their decisions. So I think childhood trauma can trigger OCD episodes. And continued trauma can trigger new OCD themes. So for example, when I developed the obsession with termites, my sister had just lost her husband. I was 25, she was 30, she had 2 children. That is the point. Till then I'd seen termites in my life multiple times, in my home also. They never triggered me, they never caught the OCD mind. But during that significant event of my life, where there was a huge change even in my life, because now suddenly she came back. There were 2 children. From 3 we became 6 people living in the same apartment. My friends stopped coming because we were 6 of us, no place to stay at night. I went through a lot of change. I started living out of the balcony. Right? So there was so much of a different routine for me now. That triggered the new theme of termites. Right? So different. When I had gotten newly married for the first time, like I shared with you, I had a bad marriage earlier. The water problem started right in the first week of the new marriage.
Wow.
So पानी नहीं आएगा, बारिश नहीं आएगी. So new traumas can lead to new themes, which is why it is very important to stay connected to your therapist when there are new themes and new thoughts.
So childhood trauma can trigger OCD overall, and new traumas can trigger new themes. That's a great framework to look at this. Another aspect of not just OCD but all mental health issues is reassurance.
Yeah.
So as soon as somebody around you is going through something, our first instinct is, oh, don't worry, there is nothing
नहीं
is
होगा.
wrong, kuch nahi hoga.
Correct.
Does that help, or can that cause harm?
It can look helpful temporarily, right? Like when you messaged me today, don't worry, you're late. I know there is rain, havoc everywhere. We'll have tea. I said, thank God. Said, okay, this man is not going to feel bad. Temporary. But in the long term, it's not helpful. I'll give you a scenario. If you have an exam and I tell you, beta kuch nahi hoga, you're too good at it, you're such a big Instagrammer, you will pass this exam. So how much will that help you in the long term? Versus if I tell you, fail हो गया तो हो गया, ठीक है, पूरी दुनिया को पता चल जाएगा तू फेलियर है, लेकिन तू कल जाके दे. लॉन्ग टर्म में आपको क्या लगता है, आपको क्या हेल्प होगा?
Okay. So in the second scenario where you're saying कि fail होगा तो भी क्या है, we can go ahead with it.
Yeah.
You are actually giving that person confidence that even after failure you can still bounce back.
Correct.
That will be more helpful over
Correct.
a long term.
Right. Now I'll explain you in the OCD cycle why reassurance doesn't work.
Right.
एक thought आया, what if I fail? Anxiety आया, आपको किसी ने बोला कुछ नहीं होगा, टेम्पररी रिलीफ. मैसेज क्या गया, मतलब सच में एग्जाम इज स्कैरी. मैसेज तो ये गया माइंड को. फिर ऑब्सेसिव थॉट आएगा नेक्स्ट एग्जाम पे, फिर एंजाइटी, फिर आप जाओगी किसी के पास रीअश्योरेंस मांगने. विद टाइम क्या होगा, रीअश्योरेंस ज़्यादा लगेगा, राइट? एंजाइटी ज़्यादा होगी, ऑब्सेशन स्ट्रॉन्गर होंगे, राइट? विच इज़ वाई डज नॉट वर्क. द ओनली वे टू handle a fear is by facing it. There is one more problem with reassurance. The minute you say कुछ नहीं होगा, एक नए ऑब्सेशन को जगह मिल जाती है, which is that हुआ तो जगह मिल गई. बट हम जब बोल रहे हैं होने दे, तो उसकी जगह नहीं होती है. अनदर थिंग, हम रियश्योरेंस लेते किससे? खुद से कि कुछ नहीं होगा, तू कर लेगा. दूसरों से, किसी से भी, डू यू थिंक दिस विल हैपन, डू यू थिंक आई वॉज सो बैड इन दिस. थर्ड, अपना आजकल का बेस्ट फ्रेंड AI. I will not take names of which AI, but we very well know which are the most common ones. अब AI का प्रॉब्लम क्या है पता है? It is over empathetic. स्टार्टिंग में when I started using AI, मुझे लगा वाह यार इतना empathetic तो मेरा हस्बैंड भी नहीं है. मैं उसको बता दी सीख तू इससे कितना empathetic है. अब AI क्या कर रहा है, आपको रीअश्योर कर रहा है, आपका बायस्ड व्यू है. AI न्यूएंस नहीं पकड़ता कि ये इंसान को OCD है, इसका हिस्ट्री क्या है, ये क्यों पूछ रहा है, राइट? विल आई बी ओके, विल दिस. So AI is very detrimental. It is going to make your condition worse actually. Temporarily it feels good. आपने थेरेपी के पैसे बचा लिए, तो लोग बोलेंगे अरे तो थेरेपिस्ट है तो बोलेगी AI अच्छा नहीं है. ऐसा नहीं है. I recently had this conversation with a client and I know he'll be comfortable with this, so I'm saying it. He sought reassurance for something on AI and I told him that you realized what you just did, and he was blown away with how often he had been seeking reassurance on AI and how it had been making his fears worse. So I said, please don't do this to yourself. Reassurance undoes your progress. Wow. There is a beautiful doctor, I say beautiful because he's very senior, Dr. Fred Pencil. जब मेरे पास थेरेपिस्ट नहीं था, उनके आर्टिकल बड़े काम आते थे. एक बहुत अच्छा आर्टिकल है, we can add it as a resource, we can send a link to our listeners. 25 tips to overcome OCD. He says, never seek reassurance from yourself or others. It undoes any progress you have made in therapy. And beautiful ending, how much ever you justify it, it is still a reassurance.
Wow.
तो किसी को ये मत बोलो कि मुझे इसकी ज़रूरत है, बट ये कितना ज़रूरी है. It is a reassurance.
Right.
So वो नहीं लेना चाहिए.
So just to sort of summarize, seeking reassurance, something that we all do in some way, in OCD can be harmful because it is actually strengthening our core fear.
Correct.
That it can happen.
Correct.
I had a very close friend in MBBS. She had exam anxiety. Brilliant student, used to come first, but before exams, full anxious. Her mother would come and stay with her in the hostel every single exam and would remind her how she's brilliant, how she's a great student, and sort of hold her hand before every exam. रो के एग्जाम देती थी, फर्स्ट आती थी. So her friends had no sympathy for her, but still she would go through this. I'm just now realizing that would it have been more helpful if her mother, if all of us would have just said, fail, no,
Yeah, exactly.
just fail once.
फेल
What
होना ही
is
चाहिए,
wrong?
बहुत important experience.
Because that woman has never failed
yeah,
in her life. She has never attempted an exam and not come first,
correct.
and that might have done more harm
Absolutely.
than failing.
When I started my private practice, my fear of failure went up. जॉब से अब पैसे नहीं आ रहे, now I cannot afford to fail was what I told myself. And the anxiety and the perfectionism went up. I would want to answer every question of the client in that 1 hour, whether possible or not. I would want to take every note, respond to every question. I later learned to set my boundaries. That I'm sorry, आपके पास 10 questions है, लेकिन हम कवर 1-2 ही कर पाएंगे 1 घंटे में. आप कौन सा लेना चाहेंगे? Shifting the responsibility back rather than taking hyper responsibility and beating myself up. Right? So definitely अगर मुझे भी बचपन में किसी ने पकड़ा होता कि इसको OCD है, she is not a good student studying, है ना, people used to tell me तू बहुत सोचती है, तू बहुत सीरियसली लेती है. अरे ऐसे विचार तो हमें भी आते हैं. ये बहुत कॉमन मिस्टेक हो जाती है लोगों की. Many times when I've told my friends, मुझे ये थॉट आ रहा है, they'll be like, हाँ हमें भी आता है. They don't understand why it is different for us.
Right.
So फेल होना बहुत ज़रूरी एक्सपीरियंस है. Recently I started learning to swim. So this has been my year of learning new skills.
Right.
37 to 38. ड्राइविंग सीखा ये साल, बाइक एक्टिवा राइड करना सीखा, और अब स्विमिंग सीख रही हूँ. सो फर्स्ट डे बैच में मुझे ही नहीं जम रहा था. 6 जन का बैच, 1:6 का रेशियो. आई सेड कोई बात नहीं, फेल होना सीख. अब तू ये एक्सपीरियंस कर. लास्ट तो ये चीज़ मैंने ड्राइविंग से सीखी. मैंने, लोग क्या करते हैं 21 डेज़ क्लास और फिर थोड़ा बहुत ब्रशअप करते हैं. मैंने 5 महीने सीखी ड्राइविंग. मुझे इतना मज़ा आ रहा था. इट्स लाइक हर डे देयर वुड बी अ न्यूएंस दैट आई वुड लर्न. ये वाले स्पीड ब्रेकर के कैसे चलाएंगे, ये वाला पार्किंग में ऊपर कैसे जाएंगे. हर डे आई वॉज लर्निंग. माई टीचर ऑल्सो टोल्ड मी, आपके जितना तो कोई सेशन नहीं लेता. सर मेरे को एकदम ऐसा सीखना है कि मेरे को कल यहाँ से लद्दाख रोड ट्रिप करना हो गाड़ी लेके, मेरे को आना चाहिए. तो 5 महीने लगे, 1 साल लगे, मैं तो सेशन लेने वाली हूँ. विथ एज आई थिंक दैट ग्रेस कम्स, कि अब शर्म नहीं है. जो उम्र लगे, जितना समय लगे, फेल होंगे, सीखेंगे, करेंगे. सो नाउ अब वो स्विमिंग में, अभी मैं फर्स्ट आ रही हूँ स्विमिंग में. कल ही अंडर वाटर वी हैड दिस मशरूम फ्लोट. आई वॉज इन साइड फॉर 50 seconds, विच वॉज द हाइस्ट अमॉन्ग्स द 6 people who were there. एंड आई हैड टोल्ड माई सेल्फ कि हुरी, पढ़ाई में तो होशियार है लेकिन फिजिकल में तो नहीं है, तो ये छोड़ दे, ये नहीं होना है. See, these are the things we tell ourselves. But इसमें भी हो गया. But again, I don't want to attach my self-worth to it. I'm being conscious about it now. So, fail होना आना चाहिए.
Again, there are similarities between this and spirituality. Spirituality also teaches you a lot of the same things. You mentioned Bhagavad Gita also once.
Correct.
That and not just for people who are suffering from OCD, for everyone.
Correct.
The importance of failing is so vital for all of us.